Hi, my name is Mark McGinn, and I am a person with pain. That pain has come about from Behçet's disease, which is an autoimmune disease that kicked off other diseases in me, such as fibromyalgia, arthritis, microscopic colitis, all kinds of things, along with osteoarthritis. This has happened to me over 45 years, so I've been in pain for the greater proportion of my life. And I have been married for almost 30 years, and for all of the time that I've been married, I have been in pain in one form or another. Much of the time in my early marriage, I was plagued with kidney stones, which was a part of this whole process. And I was in and out of the hospital regularly. I probably passed as many as 30 to 35 kidney stones, and the pain from that is horrendous. But that's not what I want to talk about. What I want to talk about is the psychological, emotional impact of chronic, constant, persistent, and I'd say malignant pain on me and on my family. And my family is my wife and my 19-year-old son. I lost my work. I was a practicing psychotherapist in Chicago and a little bit in New York. I was also an adjunct professor of psychology in Chicago, and I taught social work at Fordham University in New York for a while. I had to give those things up because the pain became so bad that I could no longer take on patients, and I could no longer do my duties as a professor. I just couldn't do it anymore. So what happened is I lost everything. I lost my profession. I lost the things that what to me made my identity. I was no longer able to play the sports that I played before. I was an avid tennis player. I had to give that up. Basketball I had to give up. When my son was born, I couldn't go swimming with him. About the only thing I could do with him was walk, do little hikes together. I had trouble holding him, picking him up. Changing his diapers was hard because I had to pick him up. And so what happened is, along with pain, one of the symptoms of pain, which I want to get across to most everybody, there are two symptoms, psychological symptoms, and those are anxiety and depression. And one of the things that people like me struggle with constantly is the constant depression that comes with the rise and fall of the pain in our bodies. And along with that comes anxiety, because you don't know how badly you're going to feel in an hour, 2 hours, or how you're going to feel when you wake up the next morning. So there's a component of anxiety and depression. Those two things have a way of isolating the pain patient, which means as a pain patient, I began to withdraw from my wife, only a little bit from my son. I mean, he kept me going. But I withdrew from my wife, and it turned out that she felt as isolated as I did. And the emotions that I was going through, depression and anxiety, she began going through in terms of her relationship with me, because she did not know what was going to happen with me. She didn't know if I was going to live or die, so she was struggling with anxiety all the time. And she was also struggling with the same kind of depression that I was. Finally, we recognized this, and we did something about it. We both got treatment for that. And the depression in me still comes and goes with the level of pain, but I know more about it now. I know how to control it, and I know what to do with it. And one of the things that has helped me so tremendously has been getting involved with the American Pain Foundation, where I am a state leader in California, and I'm a member of the Patient Community Advisory Council for the American Pain Foundation, and that has allowed me to reach out to other people, and that has significantly reduced the sense of isolation that I have. It's significantly reduced the feeling that I'm useless because I had to give up all of my profession. And it has allowed me to connect with my wife on a different level, because I now have something to talk about other than how crummy my body feels. So being with the APF has been tremendous, and I would really urge anyone in pain to come together with us to help better treatment of pain for people like me, and maybe people like you who haven't been treated yet, or you're being treated not so well. One of the things you can do is join with us and work on that. So all you people in pain like me, remember, depression, anxiety, family disruption is part of being in pain, and there is help for that, good help through psychotherapists, mostly social workers and psychologists, but you can also talk to your physicians about the pain and the depression. So there is hope.